WBUR Podcasts, Boston.
I'm Daryl C. Murphy, and you're listening to The Common. A virus known as RSV is surging among young children and infants in Massachusetts, and it's leading to another strain on hospitals. Now, bear in mind, this is happening as flu season has begun and the COVID-19 pandemic continues. WBUR senior health reporter Priyanka Dayal McCluskey has been following how doctors are handling the RSV surge, and she took a little time to talk to us about what she's learned. Okay, so before we get into the state of the hospitals in Massachusetts, I want to set the table with a few basic questions, starting with, what exactly is RSV?
So RSV, or respiratory syncytial virus, that's the whole name, it's a really common virus that has been circulating and known about for decades. And many of us, if not all of us, typically get this virus. And for most people, it's a mild virus and it feels pretty much like a cold.
Mm-hmm.
But for some people, especially for younger babies and for kids, and for some older people, it can be more severe.
Got it. So chances are, if you were sick and you thought it was a cold, it might have been RSV.
It's very possible. RSV circulates in the fall and winter typically. And so if you have a cold that time, it might be RSV. It might be some other common virus.
Okay. And it typically affects everybody, but we're seeing that with children, it's a little more severe. Is that right?
Right. So it's more severe, especially for the youngest children. So that means premature babies, newborn babies, under age 2, but it's really more concerning in the youngest kids, just maybe even a few days old. Some of the children hospitalized are really, really newborn babies.
Got it. And I guess specifically for children, what are the symptoms to look out for?
So a lot of kids will have cold symptoms like runny nose, cough, fever. As a parent, you tend to see those symptoms when viruses are circulating. Some younger kids, though, can get more sick. They can have trouble breathing. So when you see a child who is struggling to breathe, that is a sign you should probably call your doctor, and they might need to go to the hospital.
Understood. Now, I want to talk about where we are right now. I looked at the CDC data for Massachusetts regarding RSV, and I looked at the graph for PCR detections, where they detect a positive test. And I see that the line on the graph just shoots up in recent months, like between, say, September up to November. It's almost a straight line up. What is driving the surge here?
So, as you said, the numbers have increased really rapidly over the last several weeks. It's almost a vertical line if you look at a graph. What seems to be driving this, at least in part, is the last couple of winters, we didn't see the normal kind of circulation of viruses that typically happen. And doctors are saying that's, likely because a lot of us were wearing masks because of COVID risks. So when we were wearing masks the last couple of winters, that also reduced the circulation of other common viruses, such as RSV. Now that most of us are not wearing masks all the time, you've got everything circulating, all the typical germs that we normally see. But now you've got a couple years worth of kids and people who have not been exposed to this virus yet. And so a lot more kids are getting exposed to it all at the same time.
All right, we got to take a quick break, but we'll be right back with more.
Politics has never been stranger or more online, which is why the politics team at Wired is making a new show, Wired Politics Lab. It's all about how to navigate the endless stream of news and information and what to look out for. Each week on the show, we'll dig into far-right platforms, AI chatbots, influencer campaigns, and so much more. Wired Politics Lab launches Thursday, April 11th. Follow the show wherever you get your podcasts.
So, Priyanka, I understand that, RSV cases have shot up in recent months. and the hospitals are having a hard time. Can you paint a picture of what they're dealing with right now?
Yes, so hospitals are under a lot of pressure. It's really unlike anything they've experienced before. The whole healthcare system has been really stressed by the COVID pandemic. And it's not just because of patients who have COVID, it's everything else. A lot of people had to defer care during the earlier days of COVID. And so people are catching up on the care that they missed. Hospitals have reported seeing just sicker patients coming in who require more treatment, more time in the hospital. And then one of the biggest issues in healthcare right now is staffing. They're facing really severe staffing shortages. So that is just making everything harder. It's making it harder for them to respond to all the patients who need care. So you combine staffing shortages with more patients who need more care, and it's a really difficult combination. I'll give you an example of what this looks like for RSV right now. So I was at UMass Memorial Medical Center in Worcester a couple weeks ago, and they have 40 beds for children. Those were all full. And then they had about a dozen kids waiting in the emergency department who needed treatment. So that's at one hospital, and you see that sort of situation playing out at hospitals across the state. So it means longer wait times, not just for kids, but it could be longer wait times for adult patients as well. It could mean you need to transfer to another hospital farther away from home. So it is a really challenging situation for patients.
Did you talk to any doctors?
Yeah, I talked to several doctors across the state who are trying to manage this, and there's a lot of logistics involved. All day, they're on phone calls, they're talking to other hospitals across the state, across New England, to find beds for kids who really need to be hospitalized and need that specialized care to recover. So it's really been a huge challenge for hospitals, and they are still in this, and they expect it to stay kind of in this capacity crunch for a while, if not the whole winter.
This is all, of course, very reminiscent of the early days of the pandemic. And we're kind of in a similar situation with the pandemic as well, where we're getting to the colder months. It's the holidays, people are traveling, people are gathering. Are there any concerns for what this could mean for the coming months?
Yeah, definitely. I think many of us have heard this term now, triple-demic.
Yeah.
Nobody wants to hear that. But that is a term that is getting used because, as you know, COVID is still around, and we thankfully have vaccines and treatments now, so it's not the same disease that it was in 2020 for most of us.
Right.
But then you have now, as I said, other viruses circulating, RSV being the big one on people's minds right now. And then flu typically increases in the winter as well. And so doctors are really concerned that we're going to see a potentially serious flu season as well. So those numbers are just starting to creep up at this point, and they're really kind of bracing for what is flu season going to look like? What is the middle of winter going to look like?
Okay, so sounds like we're in pretty bad shape as far as having the space and capacity to treat people with RSV, particularly kids. What about prevention? What can parents do to protect their children and themselves from getting RSV?
Yeah, so there are things you can do. They're going to sound familiar. Wash your hands, cover your coughs and sneezes, clean surfaces. If you have a cold or if you have a fever, stay home. Wait till you're better. The recommendation is wait until you're fever-free for 24 hours without the use of medication. Get vaccinated for whatever you can get vaccinated for. So that includes flu and COVID. There is not an RSV vaccine available yet, but there is a flu vaccine, there is a COVID vaccine. And so they're really stressing that anyone over the age of 6 months can get these vaccines. So they are really encouraging this because it's going to cut down on transmission or at least getting a severe case of flu or COVID. So even if you can't fully prevent RSV, at least you can minimize some risk of those other two viruses. The most controversial one, but that there is evidence that this helps is wearing a mask. So I have not heard anyone calling for mask mandates, not at the level that we saw during the earlier days of COVID, but doctors are saying consider wearing a mask if you're in a crowded indoor space. And it's important to note that everyone's risk level may be different, and people can calculate their risk based on, do you have a young baby in the house? Do you have an elderly person that you're trying to protect? If that's the case, then you may take more preventive measures, and other people might not.
Got it. And as far as people without kids who may not have the same concerns as a parent, like, how should they be thinking about this disease?
Yeah, I think the same advice stands. At least that's what the medical groups say, that they encourage vaccination, because the more people get vaccinated, the more you can reduce the circulation of virus, or at least reduce severe disease. So similar to what we heard during COVID, everyone who gets vaccinated, it does make a difference in the population, not just for yourself as an individual. And even if you don't have children and you're not worried specifically about RSV, this is another major stressor on a healthcare system that's already really stressed. So what it means is, hospitals are already very crowded. And if you have any sort of medical need, any sort of emergency, and need to go in and get seen, that could affect your wait time. That could affect the availability of a bed for anyone who needs care, because emergency departments across the state are really busy. And even patients who are really sick do face waits for care. So it does affect all of us who need health care.
Understood. Priyanka, thank you. And I'm going to take this and make a little checklist and make sure I'm doing my part, because I don't want to spread anything and make anybody sick. So thank you for this. I really appreciate this.
Thank you, Daryl.
That's WBUR senior health reporter Priyanka Dayal McCluskey. And that's all for today. You can find us on Twitter at WBUR The Common, or by email at thecommon@wbur.org. And as always, thanks so much for listening. I'm Daryl C. Murphy. I'll catch you tomorrow.